Well, after the shock of how much healthcare insurance is going to cost me if I go the ACA route, the Affordable Care Act out route, I had to calm myself down and explore some new ways of thinking to see if there's a better way. So today what we're going to do on the Retirement Answer Man show, that is where you are, in the event you didn't know that, we're going to explore the Medishare arrangements, which are not mainstream, but still pretty robust, and they've been around for a while, to see if that is a better solution to healthcare before Medicare. My name is Roger Whitney. I am your host, and I appreciate you joining me today. So what we're going to do in this exploration of the Medishare arrangement is, in the Hot Topic segment, I'm going to share with you the quote of how much it's going to cost me and my family, because I need health insurance, so we can compare that to what we heard last week. And then we're going to talk to a leader at Christian Healthcare Ministry about their Medishare plan and hear from their mouth how it works, how it's different than insurance, because it's not insurance, and that's important. And then, in our practical planning segment, we're going to go back and talk to Keith and Linda about their experience in exploring this option and some of the upsides they found and some of the things that you need to be aware of so we can solve this puzzle of healthcare before Medicare. But we can't do any of that until we have this all-important disclaimer. Real simple, don't take advice from me on this show. I only give advice to clients because I'll have enough information and I'm a fiduciary to them. That's not you as of yet. So think of this as helpful hints and education. And before you make any decisions, talk to your legal advisor, your tax advisor, your financial advisor, so you can make the best decision for you. Now let's go check out Medishare. So in the Hot Topic segment today, what I want to dive into is these Medishare arrangements that are available, which are an alternative to healthcare insurance. Now notice, I didn't say Medishare insurance because, be clear, it is not insurance. It's a alternative way to help pay and cover major medical expenses. Basically, people coming together and sharing each other's expenses. In a few moments, we're going to talk to Michael Gardner, who is the Senior Director of Communications for the largest Medishare program, Christian Healthcare Ministry, and we'll have a link to their website in the show notes so you can check it out for yourself. But before we talk to Michael, I want to give you an idea of what I experienced in applying for Medishare, because I'm going to apply and assess whether this makes sense. Because if you remember last week, my health insurance estimate through ACA for my family, I'm 51, my wife is around me, and I have two kids in their early 20s. In ACA, traditional insurance was about $2,100 a month. So it makes sense. I got to look at different options. Next week, I'll explain what our COBRA option looks like. So I went to Christian Healthcare Ministry and I went through the application process, and we looked at a $5,000 household portion. Not calling it a deductible because it's not that, but the portion that we're willing to self-pay before we would turn to this expense sharing program. So in insurance parlance, we'd call that a deductible. So for a $5,000 household portion, my family premium, which they don't call it a premium, it's a standard monthly share, would be $516 a month. If I were willing to have my annual household portion be $10,000, it would be $343 a month to participate in the program. Wow. So we're going from $2,100 a month to around, we'll call it $400 a month if it's somewhere in between there, that share portion. That is a cost difference from a monthly payment perspective of about $1,700. That's significant. Now, as we talk to Michael and we talk to Keith and Linda a little later on, you'll see that there are some catches there there are some downsides or potential downsides that you got to be aware of. You're not just quote unquote saving money. A lot of times we'll take the short-term benefit of a lot lower payment because that's an immediate thing that we know is real and trade away a potential bad scenario somewhere down the line because it's only theoretical in that standpoint. And that can be a trick that our minds play when we're making these calculations. So my wife and I are talking about this because we're seriously considering Christian Care Ministry, but we understand that it's not insurance, and there are some benefits to having some guarantees through something like the ACA or something like that. So to be clear, we haven't made our full decision yet. If I had to guess, my guess is that we are probably going to go the Medishare route, and I'll inform you once we get to that final decision, but that's a significant difference of about $1,700 a month. So it's definitely worth exploring. So to do that, let's start off with talking to Michael Gardner from Christian Care Ministry about the program, and then we'll pivot in the practical planning segment to Keith and Linda to get another outsider's view of these arrangements. So let's talk to Michael here. So Michael, up until about maybe 8 months ago, I had never heard of this Medishare structure of dealing with healthcare costs. I had a client who's a doctor, a neurologist, that brought it to me, and he's a member. So why don't you give us the basics of what this Medishare structure is, and I guess what it isn't?
Sure, absolutely. Happy to. So Medishare basically is a medical cost sharing program. It's a healthcare sharing ministry. And so what that means is that our members, and we have more than 375,000 members today all across the United States, each month they come alongside one another and share each other's medical bills. And so we can talk a little bit about the specifics of how that works. But one of the things I think it's important for people to realize is that it really is a direct member-to-member sharing experience. So I know every month the other members with whom I'm sharing, and we actually connect people in community. Community is very important to our membership. So I know the people that I'm sharing with, and I also can reach out to them and let them know I'm thinking about them. We're a faith-based organization, and so our members value prayer as well. So I can reach out to that person and see if they have any specific things that they'd like me to pray for. And so coming together, one of the things that members really, truly appreciate once they get involved in the program and see how it works.
Okay. So it truly is. What I had visually when you were talking about that is like people coming together to help build a barn or a church, right?
Right.
It's community.
Right. Absolutely. Community. Absolutely. And it's based on the idea that, when we come together and we share the resources that we have, people's needs get met. And they certainly do. Since 1993, our members have shared more than 1.5 billion with a B, in medical bills. And so that's quite a big barn, right? That people have come together and helped one another with.
It's interesting. So it's been around for a long time, and that's a lot of members. I mean, I'm surprised I'd never heard of it before. And to be very clear, it is not insurance, right? It's different.
That's correct. It's not insurance. It's an alternative. And so, the Affordable Care Act provided lots of different ways to meet people's healthcare needs. And healthcare sharing ministries were actually one of those things. So there is a provision in the Affordable Care Act for healthcare sharing ministries. And basically, participation in one of these programs meets the requirements in the Affordable Care Act to have some sort of a healthcare solution. So you're not subject to a financial penalty at the end of the year. And I think there's a lot of misunderstanding about that a lot of people seem to think that's going away. And so for the current calendar year we're in, that individual mandate still exists. And so people do still need to have some sort of a solution or possibly be subject to penalties. And so Medishare allows them to meet that requirement in the law and also find an affordable solution for their healthcare.
So what are some of the distinctions between traditional insurance and this non-insurance solution that people should be aware of?
Sure. Well, first of all, we're a not-for-profit organization, and so we do try to reinvest back into the program and back into the community. That's one of the major things. The fact that we don't pull all of our members' funds, that it really truly is direct member-to-member sharing, that you have that ability to know with whom you're sharing each month is another thing that makes it quite different. Because we're a faith-based organization, the thing that our members tell us all the time is that when they call in, we offer to pray with people, and that's something that people probably don't experience with any other kind of a healthcare solution. So it really is people coming together and supporting one another.
So explain that it's not pooled. So if I'm a member and I have a minor surgery and it's $3,000 and it gets worked through this, so how exactly does that work in practice where it's not pooled? I'm actually going to know who was getting some money.
Right. So let's talk Medishare by the numbers. There are really two numbers you need to understand when you're considering Medishare and how it would work for your particular situation. The first number is called your monthly share amount. So each month I deposit into my sharing account. Every member household has their own individual sharing account. Each month I deposit a fixed amount of money into that account. And it's important to realize and to understand that that money is not used for my own medical expenses. Rather, that's what I am sharing and committing to share with other members each month. Okay. The second number is called your annual household portion. And it's really the amount of financial responsibility that you as a member choose to bear on your own before your bills get presented to other members for sharing. And there are different levels that allow you to customize that. So you can choose from one of 7 different levels, as low as $500 up to $10,000. And so they're in increments, $1,250, $2,500, $5,000, so on and so forth. So you really can customize it based upon, where you are in your particular life journey and financial journey. So if someone is young and just getting started out and doesn't have a lot of savings set aside for some sort of a medical situation, should it arise, they may very well opt for a lower annual household portion.
I know you don't call it that, but in insurance terms, that would be called a deductible or money out of pocket. But you don't call that in the Medishare world. But that's essentially
exactly, yeah, similar concept. It really functions more like an out of pocket, maximum out of pocket. So for example, my family, I have a family of 4. I'm in my mid 40s, and we've chosen a $10,000 annual household portion. And so we understand that means that if we have certain medical needs that arise, we're going to be responsible for the first $10,000 of our medical expenses before the other members come alongside us and help us to lift our medical burdens. And so it really is customizable in that sense.
So I hate to say the word because I know it doesn't apply, but so up to that 10,000, there's no copay or whatever the equivalent might be. That is, you're paying the first 10,000 before you go to members.
You are. That's right. And now, we can talk a little bit about the experience that you would have if you actually go for care. And it probably feels familiar to people. It's not really a strange concept. If I'm ill, I go to my provider, I show them my Medishare membership card, I pay a provider fee, and I get the care that I need. And then the provider sends their bill to Medishare. And what we do is we encourage members to use an in-network provider. They're going to certainly have a lower cost by doing that. We do have access to a PPO network of more than 700,000 providers. And so the provider then sends the bill to Medishare. We make sure that it's discounted based upon that PPO network and those agreed upon rates. And then if a member has met their annual household portion, it gets submitted to the other members for sharing. If not, it's the member's responsibility until they meet that annual financial amount. That's right.
So let's talk about that, because I had a couple of questions on that. So now there are, I think, maybe 4 Medishare organizations like yours. Yours is the largest. And I think yours is the only one that actually taps into a established healthcare network like a PPO, right?
Mm-hmm.
Okay. So, and I've read some articles where a lot of doctors and offices aren't as familiar with this structure. And so it can create some confusion. So I guess this is just part of the member having to work through and educate these PPOs or the actual doctors if they've never really encountered it before.
That was my experience when I first became a member, that, it didn't require a lot of extra work, but I did do my research ahead of time, and I made sure that the providers that I want to see were in-network providers. In one circumstance, for my son's pediatrician, he wasn't at the time in network. And so, we just had to understand going in that was going to be the situation. But we do have a provider search function on our website that people can certainly use to check if their providers of choice would be in that network or wouldn't be. And you can certainly use that before you ever become a member to see if it would work best for you. And when you go to the provider's office, it's simply a matter of showing them my card, explaining what it is, and working through, an initial setup visit, if you will, with my provider.
And so a lot of that is because this is a little bit unusual or a little bit out of the mainstream. You have to educate people, because they don't see it every day. Okay.
There is a little bit of that for sure. It's definitely a different type of solution from what people are used to with insurance. And so we do have folks here who can answer questions day in and day out, either on the phone or online. Certainly people can learn more about this. But we always do have people here who are happy to talk to people who are interested in the possibility of becoming a Medishare member. And they can answer questions about what this would look like for your particular family, certainly what the cost would be. They can talk through any of the particular health situations going on and what the implications would be. There's a medical questionnaire. The application process is is pretty simple. But, we do ask people to fill out a medical questionnaire. We never turn people away due to medical reasons, but there is a questionnaire that helps people understand what types of things are shareable needs, what types of needs are ineligible for sharing, and which types of limitations. So there's a really clearly defined set of member guidelines that dictate the program and what types of things are shareable and aren't shareable.
Okay, now, do you have any data on, so the doctor submits it to Medishare, and then it comes back that, hey, you didn't meet your deductible, and then you pay? Is that how it works?
It is, right? So what will happen is you'll get, after you have a provider visit, my experience has been that typically I'll get a notification, it's called an explanation of sharing from Medishare that says, here's what the provider billed, here's what the discount was because you used an in-network provider, here's what you already paid the provider up front for your provider fee, and then here's the balance that it's your responsibility to pay. And so, you typically get that, and then I'll get a bill from my provider sometime later, and I can match those two things up and say, yep, this is the correct amount, it all makes sense, and then I simply pay my provider bill.
Okay. And then now, do you have any information when it's up to Medishare to cover from its members has there been any issue in terms of the timing? Because it ultimately all comes back. So let's say I'm a member, it all comes back to my credit, right? And so if it's submitted and Medishare is required to pay or fellow members are required to pay, is there any data on how efficiently that happens? I've heard that there might be issues there, so I just wanted to address it.
Yeah, I think a lot of people kind of group all the healthcare sharing programs together in terms of how they perform that way and the time to pay. I know that's one of the things that providers do seem to appreciate about the program is that the bills do get paid quickly. And so haven't heard a whole lot of complaints from people about that being an issue. I think to the extent that, if there are ever issues, what we have seen is that a lot of times the confusion comes down to, was this in fact a shareable need or was it not a shareable need? And so, sometimes we do have to work through those issues, but we have processes in place to work through that with members. And certainly if there's ever any kind of a dispute about it, members can certainly appeal any kind of a sharing decision. We do have a member review board as well that actually looks at those circumstances as well to make sure that things are processed according to the guidelines.
Yeah, and everything I read online, you've been doing this since 1993, correct?
That's right.
Read online has been very positive. And as the listeners know, outside of this interview on this episode, I'm applying right now and I'm evaluating this for myself. So
that's great.
So if I have a $10,000 deductible now, these type of plans don't qualify for like an HSA account or any other type of tax advantage savings account, right? Those fall outside of.
That's correct. At this point, they don't. I think there's some legislation that's been introduced a couple different times throughout the years, and I think it's still kind of making its way through the process. But right now, they're not compatible with an HSA plan. That's right.
Okay. Well, let's get that passed, would you? Work on that. Now, does it come with prescription benefits, and how do people manage that? Because I don't think it does, right?
Sure. Yeah, we can talk a little about the specifics of sharing, and that's, I think, kind of what you're getting at. So prescriptions, for example, all of our members do have access to prescription discounts. You can show your card when you go to a pharmacy, and there is definitely a prescription discount available. Prescriptions are generally shareable for 6 months. So that's one of the things that I think people should understand about healthcare sharing programs, ours in particular, is that the program is really there to lift burdens, right? Medical burdens. And so there are certain things that are generally not going to be shareable or will be shareable, but with limitations. And prescriptions are one of those. So generally speaking, prescriptions are shareable for up to 6 months for a new condition. So what that means in effect, though, is that if I'm diagnosed with, say, high blood pressure, right, and I've met my annual household portion, my prescriptions for that new condition would be shareable for up to 6 months. After that time, it would be my responsibility as a member to cover the cost of my prescription. Well, so that is one sharing limitation.
Okay. And I think a lot of this means you have to be a little bit more of a good consumer about this stuff as much as you can.
That's right. And I'll give you another example, too. One of the other things, too, that's different, and this you had asked about some of the differences between sharing programs and insurance. With Medishare, for example, because it's intended to lift burdens, one of the other things that I'm responsible for as a member is my routine and preventive care. So that means that if I know I'm going to need to have an annual physical with my primary care provider and I'm going to need to have some blood work done, I'm going to be responsible for that. So that just means I need to be a good financial steward and say, I'm saving a lot with Medishare compared to what I'd be paying with another solution. It's just good financial stewardship to set some of that savings aside because I can plan for those things that I know I'm going to need from a maintenance and routine care perspective every year. Now,
one thing that came to mind when I was thinking about the prescription end of it, and I don't know how this works, but what happens if there's a major illness, whether call it cancer, right? And a lot of times there are some drug regimens that are pretty robust and can be crazy expensive. So is that considered prescription, or how do those typically work out?
Each of those cases would have to be considered kind of on a case-by-case basis. My sense is that it probably wouldn't be. I mean, we've had members with cancer. We've had members with organ transplants, really serious injuries and illnesses as well. And those needs have been shared over the years. So the guidelines really clearly spell out all of those details. The specifics about conditions like that, we would refer to our care team. So we do have a care management team that would walk through that process with a member and walk through that treatment with a member to make sure that they're getting the right care at the right place and trying to make sure that they can minimize the cost to them.
So are there prescribed limits as far as sharing?
There are not. There is no lifetime maximum and there's no annual maximum right now with Medishare. And that's one of the questions to ask as you're exploring different healthcare sharing options. All the sharing programs are great programs. They all do sharing a little bit differently, though. And so I think those are some of the questions people should ask when they're exploring their options. Is there any kind of a limitation on what's shareable? Some of the programs ask you to do a little bit more work up front. For example, negotiate a rate with your provider, or, you pay your provider up front and then seek reimbursement after the fact from your fellow members. Our process automates that quite a bit more, but it is something for people to ask about. It just depends upon this. I have friends who are members of other sharing ministries, and that's really a good fit for them. We try to use technology to kind of leverage that and make it as easy as possible for members. But those are some of the things people should certainly ask about. How much work are you going to have to do on your own? Is there a network? Those types of things.
Well, let's go back to the barn example. So if I'm building the barn, I got all these people coming, and then there's this guy, Joe, and Joe is just more trouble than he's worth in the project. You say, Joe, just go home, buddy. So is there anything like that in this group, right? Because this is a ministry. Do people get kicked out? And how could that happen if they do?
So there are a couple of different things that really govern membership, right? It's a membership-based organization. And so first and foremost, we're a community of faith. So there is certainly a statement of faith that we ask people to review and make sure they can agree with before they do join the program. There are also certain lifestyle agreements and requirements that we ask members to follow. So we do ask people to be tobacco-free, not just cigarettes, but any tobacco. We ask people to abstain from abusing alcohol or prescription drugs, and certainly not to use illegal drugs. So there are guidelines like that. Now, I mean, in effect, we probably wouldn't know about a situation like that until, we were presented with a medical bill for something like that. But for example, if someone ended up having an accident because of an alcohol-related issue, right? Generally, those bills wouldn't be eligible for sharing. We certainly wouldn't turn a blind eye on somebody in a situation like that. We would refer them to some sort of a resource to help them get support that they would need for those kinds of things, counseling and recovery and that kind of thing. But there are definitely requirements like that in place that would prevent the sharing of things counter to that.
Right. And I get that because it's a ministry. So I just want, because you brought that one up, I just want to ask a follow-up on that one is, Sure. This isn't going to happen. But if I am driving and I am intoxicated and I get in an accident and I break my leg, so that would be something that would potentially really not be paid for because I was abusing alcohol in that scenario.
That's correct.
Okay. That's an important, but if I get hit by a drunk driver, that's a separate thing because I wasn't doing anything.
Right. Different issue.
Okay. Now here's probably the most important question is what did I not ask that I should have?
We can talk a little bit about some of the add-ons and the perks that you get from membership, because I think people hear about the low cost. The average family pays probably around $350 a month is the monthly share amount. And a lot of members typically report that they're saving about 50% over the cost of some other solution. I did some exploring this year on my own, and I'm certainly saving more than that. So for my family of four, we pay right around $290 a month as our monthly share amount. That was certainly the best solution that I could find for us. So, cost is one issue, and I think people hear about that and that piques their interest. But, there are a lot of other things we do to try to help people be well. At our heart, we're a sharing organization. We want people to be well so that they can go out and impact the world and do good things out in the world. And so we try to make sure that they're fit spiritually, physically. And so we do have care managers and health coaches on staff who can help people improve their health. So, when I joined, I actually paid a little bit more each month for my membership because I was a little bit heavier than I should have been. And I worked with a health coach for a couple of weeks and actually lost some weight and ended up seeing a savings in my monthly amount as well. So we have coaches on staff who can help people make lifestyle changes and get better. With your membership, you also do get access to dental and vision discounts. It's not dental and vision insurance, but it is a dental and vision discount program. And I think one of the most exciting things that we've added recently mentioned that we try to leverage technology as much as we can. We actually added a telemedicine program about a year and a half ago. And so now all of our members get access to basically no cost doctor visit 24/7 through a medicine program. So I can actually call a doctor or do like a video phone visit with a doctor at no cost, no additional cost to my Medishare membership, no per visit cost. And, from clicking a button to see a doctor to, getting diagnosed and getting a text message from my local pharmacy that my prescription ready is like a 30-minute proposition, and I can do it from home, And so, I have two relatively young children, so we have definitely gotten all of the value possible out of that program, so it's great for things like, strep throat and pink eye and the cold and flu and those types of things.
Yeah, which is the majority of visits for most people, right? It's just those annoyances that come
Right.
up.
Right. And that was a lot of the motivation, right? Is somebody like me who has a $10,000 annual household portion, I know that means every time I get sick and go to the doctor, I'm going to have, some sort of a cost for that visit. And so it really does provide an option to help reduce, my out-of-pocket expenses. And, we've used it. Oh, I bet you we've used it at least a half a dozen times in the last 6 months. So it really has saved us quite a lot. And we're hearing really good feedback from members about their experience with that as well.
I think that's great. You know what one of the biggest benefits of that is, just from a personal level, is I don't have to step on a scale and look at it, which I have to do every time I go to a doctor. And I always have my heavy clothes on for some reason.
Right. And you can avoid, all the people coughing and sneezing in the waiting room as well. That's one of the things people really seem to like.
Yeah, I think that's a great resource. Well, Michael, I've really peppered you with questions, and I appreciate you sharing what I think is a really unique way of solving and bringing community together. So very interesting. I'm excited to explore it for myself.
Yeah, let me know what your experience is like, and I really appreciate you including us on the program. If anybody has questions, like I said, they're certainly welcome to call in and ask us any questions they have about what this would look like for their particular family.
That was great info. Michael did a great job. Now, let's go to Practical Planning and talk to Keith and Linda about their experience. All right, we heard from Keith and Linda last week on ACA, and Keith does his homework, and he did his homework on Medishare. So let's talk to him about the intel he has garnered through his research. So Keith and Linda, now I want to look at an alternative that is clearly not insurance, which is an important distinction. And that is these health sharing organizations or groups that we are seeing ads on, Medishare or Samaritan, or like 3 or 4, I believe. Now, you evaluated these, right? Because obviously they seem to be attractive from a price perspective. What did you learn about them, and what's your understanding of them?
Yes, we did quite a bit of evaluation, and I actually ended up applying to Medishare during open enrollment period. I applied to both the ACA plans and Medishare because I wanted to learn more during that application process in terms of their responsiveness and how they were as an organization. And I just wasn't satisfied enough with reading blogs or on internet, commentary. And so I'm like, I want to experience it. And I thought I could do that through the application process. So I had selected Medishare. The 4 big ones are Liberty, Samaritan, Medishare, Christian Health Ministries, I think, CHM. And I selected Medishare, or narrowed it down to that, because they utilize a doctor network that is previously established and not associated with Medishare or any of the health sharing ministries. It's for private healthcare companies that set up networks. It's called PHCS.
So they plugged into the system a little bit.
Exactly. And so there was a familiarity to it. There was if you went to the doctor and you say, I have the PHCS network, they're like, all right, good. And you can look up doctors and see if they're in network. It had the same look and feel as traditional network health insurance networks. And so that was very attractive. Medishare promotes that, and it's a very noticeable advantage.
Let's talk first, before we go there, let's talk first of explaining exactly what it is. So it is not health insurance. It is, in fact, they don't use any health insurance terms, and they really don't want to. It's basically private individuals grouping together and literally sharing medical costs together. And it's just facilitated by one of these organizations. Is that a good summary of that? You've researched it more than I have at this point. Okay.
Yes, that's true. There is one other critical requirement, and you have to have a statement of your Christian faith.
Right.
And some of them have different definitions in terms of their scope of what that is defined as, but you will sign a document that you will live by their statement of Christian faith promise. And the other noticeable difference, so that gives them the exclusion from the Affordable Care Act legal requirement. So this is an exemption. And when you do your federal taxes, if you select one of these companies, you will check a box that says, I am exempt from this ACA requirement because I chose to go with one of these companies.
And I'm assuming it's literally, now the companies I know are a religious test, but could other groups of people form in a similar way, or is it specific for religious?
No, it's specific for religious.
Okay.
The federal government gave the exemption based on religious requirements or religious elements. You would be able to say, I am not buying traditional health insurance because I'm pursuing this religious exemption.
Okay. So what did you discover? I mean, obviously, you're right. The cherry I think you used is accurate is the premiums are significantly less. I don't know if they even call them premiums, right? The amount that you are willing to share.
That's right. So the look and feel is the same. They can't use the same terminology. So your sharing amount would be the equivalent of your monthly premium. They can't use a deductible. They have other terminology, but it has the same functionality and look and feel as insurance, even though there is no legal requirement for them to pay. I don't think any of them have ever not been able to pay because of financial failure. So I don't think that is a concern or has not been a concern. And many of these companies have been around for 25 or more years. So they have a good track record and they're long-standing.
I think one of the reasons we were interested in one of these programs as well was that if we did move partway through the year, we wouldn't have to, get a whole new healthcare thing going. We could go from state to state with that.
Yeah, so you have a little bit more stability of we don't have to think about this all the time if we're going to be mobile.
Right. Right.
That's right. Yes, you're not tied to an Affordable Care Act, you're tied to your zip code. And if you move out of your zip code or your county, you have to reapply and change everything. And so even the Medishare PHCS system is a national system. So if you're highly mobile or going to be moving around, this is a real advantage to just, sign up and wherever you go, you can utilize their services.
So how was the application process? And do they care about pre-existing conditions? And how did that all pan out for you guys?
Yes. So their advantage is they are able to apply pre-existing conditions and they have exclusions based on poor health choices. So you will sign a document that say you will not abuse alcohol or use illegal drugs. And you will have I'll call it a light physical. You'll have to record your health information during the application process. You will have to provide your blood pressure levels and your BMI. And you will state in writing and sign legal documents that say you will try to do the best to live a healthy life in general. And so, as they are not required, as the Affordable Care Act is, to accept unhealthy patients, to be blunt. That's what
they can do adverse selection.
They
can do adverse.
That's right.
Yeah, in the pre-existing conditions.
In the pre-existing conditions, so in my particular case, I had in the previous year had knee surgery, so I had to record that. And, when the application was finished, they're like, great, you had a Medishare's case. I think it was a 3-year exclusion for the left knee. So if I had to go back and get it fixed again, or I had to go get therapy on it during that 3-year period, it wouldn't cover any of that.
Okay. So that could be, if you've had recent cancer or you've had other things, that could easily make this a no-go.
Right.
That's right. In general, to stereotype these, I think they are attractive to younger people, not people in their mid-50s to mid-60s, although we know personally people that are doing it and they're very happy with it. Some of them are. But I think if you looked at their people that have enrolled, they're single or couples, maybe not so much large families, you're going to be a mild consumer of healthcare and you want low premiums. That's the attractiveness of these companies.
Yeah. Now I'm walking this journey and I do have some clients that are on it that are in their 50s. And generally, and I get this, they are financially, they live healthy lives. So there's that selection, but they generally it's still cheaper, and they generally are self-insure because they have the resources to, right?
Right. Well, and it's the math is back to my spreadsheet life. And the math is really compelling. So for a quick apples to apples comparison, for me, if I didn't get the premium tax credit, the typical premium for a silver plan would have been somewhere in the range of $1,200 to $1,500 a month.
That's with a high deductible.
That's right. That's not a good plan. That's just barely a good plan and a bronze plan. And so then to compare that to Medishare or Liberty or Samaritan, they're operating down into the $300 to $500 a month, all things trying to be equal comparison. So, we're like, wow, I could save, up to $1,000 a month. And,
that's a lot of money.
It's a lot of money. It's $12,000 a year. So if you were to say, I'm going to budget, here's what I did. I budgeted $15,000 a year for healthcare.
Right.
That's for doctor visits, premiums, prescription drugs. That's in my budget. And so then if I had gone with Medishare, I would have tried to be diligent and take that extra $1,000 and built it up. Now, you can't build it up in an HSA, a healthcare savings account, because it's not an Affordable Care Act plan. But you can still save it and maybe create your own separate account. And it'll give you peace of mind that if you then have an event that costs, you need that $1,800 MRI, you're like, oh, there's the money. I can do that. So it's very compelling from a financial standpoint.
So why did you not choose it?
Okay.
Well, one of the reasons was we're really trying to figure out how it would work and operate in our real world. And so I wanted to call some of my doctors and talk to the accounts people and say, do they pay on time? Do they actually pay? And we did run into where, my one doctor, they were saying, well, we do have clients who are on that and we do eventually get paid, but not on time. And the clients are calling regularly and saying, oh, it's coming. And, part of me I just didn't want to have that be a part of my everyday life, to have to worry about whether or not the money was coming through. It just wasn't something I really wanted to be focusing on from my end. I didn't want to do that.
That makes sense.
I agree.
And you said you actually called the billing department of one, didn't you?
Yes, I did. I called because there was some concern. And so I had called Medishare and talked to their accounts payable department and asked them. And they were very nice. The salesperson was like, yeah, I can connect you to that department if you want to talk to somebody direct. And I expressed my concern that, I had heard that there was some slow paying. And I asked two questions. I said, can I go to the doctor and just pay the bill myself in full and seek reimbursement from Medishare? And in their case, the answer was no. They're like, you have to have the bill from the doctor, go straight to Medishare, and the Medishare will administrate it, pay their portion, and because it's all pre-negotiated. And now the other ones don't do that. You could pay the whole bill and try to get reimbursed from Liberty or Samaritan or CHMI, but Medishare was, no, you can't do that. And so I'm like, well, then how late do you pay? Basically, it was sort of an awkward question.
Yeah.
And they did say it could be up to 60 days. And although that doesn't sound horrible, it does result sometimes in late billing notices and the doctors becoming frustrated and seeking you out. And it could affect your credit score if you're, because the doctor's sending you bills saying no response and you got to pay this. And then you're sort of stuck in the middle trying to get them together. And I just didn't feel comfortable with that. Now, the other reason that I didn't go this route, when I may go this route next year, is that I got a premium tax credit. So it brought down significantly, more than cut in half my Affordable Care Act premium to a level that was slightly more than the Healthcare Ministries. And I decided, well, then for $150 a month more, I'll just go traditional insurance. If that difference was 2 to 1 or 3 to 1, it's compelling to use these Healthcare Ministries.
Now, in your research, did you find any commentary online about the slow pay issue that you were concerned about?
Yes, there is. And it's hard to tell, in all fairness to anybody out there, just commentary and reviews on articles as, people chime in. And, I think there's a preponderance of complainers over people that want to give kudos to all organizations. So The complainers get the most airtime. And that's really what I was trying to seek out. We know a very nice family locally that uses Medishare, and they're very happy with it. Now, they don't They didn't have surgeries or any big events. It's just kids going to the doctor and annual checkups and things like that. So they didn't have, much real time evidence there. Somebody else from Samaritan that's very happy with it. So
we found that one of the things for us is Keith tends to use the health budget in the family. He's got a lot of old sports injuries and such, so he's the one that tends to get the surgeries and the therapy and all that. So it was more of an issue for us, I think.
Okay. Yeah. And then how does prescriptions work with a plan like that? Do you have to just go find a prescription discount plan separately?
Yes. Most of them do not cover prescriptions. So if you're on a non-generic prescription, that could be an issue. And if you're on generic prescriptions, it's, I found through some discount programs, 2 I use are GoodRx and Lowest Med. I have them both on my phone. I show up at the pharmacy. I'll test whatever it is I'm picking up with both apps. And it's very, very affordable. I mean, a 30-day supply of generic prescriptions is really going to be $10 to $20.
But if you get into that cancer situation where there are some serious drugs going on, then
yes, and that would be. I do not have a good understanding, although I think I'm right in saying that the health sharing ministries in general do not cover prescription drugs. And most of them will say, well, who's it good for? And they're really not focusing on people that are high use health, people having very expensive illnesses and things. That's not really going to work out for them.
Yeah. Right now we're healthy, but it could be the diagnosis tomorrow. Right. And that's
right.
part of the risk.
True.
So
that's right.
From a financial perspective.
And they do cover that. They do cover that. I mean, it's not like, but if it was a pre-existing condition, if you had shown up and said, I had previous cancer and, within the last few years, then that would be written out of your policy. That would be an exclusion.
Yeah. Well, I'm even thinking from the drug perspective. If I'm healthy today, but I go on this and I have cancer a year from now, I better have the financial resources to handle the drug part of it as well.
The drug part. Now, the health part, the hospital visits, doctor visits, whatever, therapy is required, that will be covered by these plans. Whatever, there's a term deductible. It's called the share.
Yeah, don't use that term. Maximum. Come on, you can't use that term.
No, I know. I can't, use that word. But, they can be anywhere from $500 to a $10,000 out-of-pocket responsibility. And then their portions kick in. The coverage kicks in.
So you said there's 4 major ones in your analysis. Can you just briefly describe whether I don't know if they all have a sweet spot within that marketplace or not?
Well, the Medishare stood out because they had their own network of doctors. It wasn't their own. They attached themselves to a pre-existing network that was well recognized in the health insurance industry. So that was a big plus for them. The other ones didn't have that, but they had the advantage of saying you can go to anywhere you want and you can pay your bill in full, or you can, if they recognize and will work directly with the health share ministry, then the doctor would first bill them and then, it would be processed and you'd pay the difference. There is one thing that popped in my mind that is, it's an ugly term in the health insurance industry. It's called balance billing. Okay. And most of the health insurance companies through the Affordable Care Act, it is not, I'll say, legal. It's a violation of the policy to balance bill the patients. And what that means is that you go to the doctor, you give them your copay, and you pay your $50, but the total bill was, let's say $150, and the doctor says, well, the insurance company didn't pay as much as they're supposed to, so you owe us the difference. And that can be a significant amount of money. That can and does occur in the health share ministries. The Affordable Care Act, if the companies sign up and the doctors sign up for a network, they can't do that with the Affordable Care Act. So that's sort of a risk. I don't know how prevalent it is that you think you have a negotiated rate and then you get a bill when it's all settled out that you owe the difference.
Yeah, and the hard part with stuff like that, I've always found, Keith, is a lot of these risks are in the future and, depending on how you handicap it in your head, highly unlikely. And you weigh that against the premium that I'm going to have to pay every month is certain, and it's a huge difference. right? So it's easy to discount those risks, and it's more of a mental, emotional game than it is a financial game because
That's exactly right.
We're hardwired not to have the immediate pain of having to pay $1,800 a month for a premium. So we say, that's not going to happen, right?
Mm-hmm.
Right.
I don't know how you resolve that, but that's definitely, that's my intuitive reaction. Well, don't worry, that's not going to happen, but it could, right?
It could happen. Yeah, that is the tension between the analytical side and the emotional side of this, and it is true.
Yeah, and we own our consequences, whether they come up next month in the bill or 10 years when it happens. The unexpected actually happens. But you say that you may still pivot to that, so give me some color to that. What is your thinking there?
Well, yeah. So in the fall of last year, November and December, I was going to my physical therapist for my knee, and he was like, so what do you pay for, I was telling him all about what, whether I was going to go with Medishare or the Affordable Care Act. And he was like, gee, this is a physical therapist. He's like, you should just self-insure. He goes, and just buy catastrophic insurance. He's really just pushing that because it's just not that expensive. If we were to walk in here, you're paying me $50 copay. But if I didn't have any insurance, it'd be $65 for the visit. I'm like, well, that's not a big difference. I'm not really getting much for my money, and that big high monthly premium, all it's really getting, the delta is $15.
And that's where my mind was going as we were talking. Is like, okay, well, what about just catastrophic? So I like that you went here. Go ahead.
And so the prescriptions, as long as you stay on generic, that's very affordable. And if you shop around, you can really control these costs quite effectively. So that's probably next year, now that the Affordable Care Act mandate is then repealed with last year's budget approval, that those plans will make a big comeback. They're not allowed in the Affordable Care Act. Not that you couldn't buy them now, but they were not compliant with the Affordable Care Act. Now I think there'll be a resurgence, and I'll be definitely looking for that and comparing that to now. Should, my health profile change over the next coming years, that can have an effect on whether you want to do that or not. If you're just an occasional user and once in a while, maybe you have to have a knee surgery every 5 years or whatever, that's the way to go. It's the math says to, buy high deductible or catastrophic insurance.
But to be clear, like the bronze plan or the ACA plans already have pretty high out of pocket. So it's not like they're... Yeah.
That's exactly right. It's really, you cannot, through the Affordable Care Act, get as good as your employer-sponsored plan. I had a $750 deductible with my wonderful corporate plan. It's just not available on the Affordable Care Act. And maybe you can get it down to $2,000 deductible, but it'll cost $25,000 a year in just premiums. Yeah. I saw some premiums that were $3,800 a month. And I'm like, what? How? I thought it was a typographical error. And the dot's in the wrong place. But that's, so even, I don't know if the math ever works out for a person to try to select a plan that has very low deductible, very low out of pocket. The insurance companies don't want you to go there, basically, well, and they price it accordingly.
And think about what this does from a decision tree standpoint. Because in my mind, as you're saying all this stuff, I'm like, well, heck, I just go to one of the health share programs. And then if I get cancer, I just go back to ACA because they don't care about pre-existing. I mean, that's the gaming that potentially you try to figure out because of how wacky the system is. Because I'm assuming you can actually do that.
You can do that, but you also have to have a life-changing event in order to enroll outside of open enrollment period, which is usually the first part of December, late November to first part of December. So moving is a qualifying event. Having a change in your family status, having a baby, those are all qualified events.
Well, we can't have babies. So if that happened, I'd just say I'd either have to move or divorce my wife. Just kidding.
And actually, I just read an article last week on the federal government crackdown and changed the rules on people that would, because just because you get cancer in June doesn't mean you can sign up in June. You have to wait until open enrollment period.
Good
and
point.
Maybe you can't wait 6 months because that's too big a health risk. And so what people were doing is they would, and I don't blame them, they would pack up and move. to create a life qualifying event and then get it. They would physically move to a different county or state in order to qualify to be able to get on the Affordable Care Act. And they don't allow that now. Or they'll try to upgrade a plan. Let's say they signed up for a bronze plan and all of a sudden they get very ill. Then they're like, hey, I'm going to switch to the gold plan because that's, they run the numbers and that's going to be a better situation. You're not allowed to do that.
Well, and this is what this all creates, though, is the gaming of. And my other thought is, I know the listenership of the show for the most part. We skew towards healthier, more financially sound than the majority of Americans. So so you take someone who is quote unquote normal from a financial standpoint, looking at these premiums and trying to figure this out. I don't know how it works. Even with the subsidy, I guess that's where you could have the benefit of it, but still it's intimidating.
Yeah,
it is intimidating.
Yeah. And when we were going through all the options, I remember thinking, what kind of algorithms do they have in this insurance companies that they got to be making some money. So they just have, all these variables turning and changing and very difficult to try to figure out what one really is the best plan,
And this is where you end up.
It's pretty complicated.
Yeah. I mean, if life really hits you hard and you're on a health share or whatever, then you really seriously have to look, okay, do I go to the Philippines or to Mexico or to Canada or somewhere else? And you're shopping your healthcare worldwide if it's a life event that needs to be taken care of.
Well, that is the other choice. And there's read articles and listened to a couple financial blog podcast articles on that. And some people are comfortable with that. I have not done that. I'm not sure that would be my first choice.
The last time my wife wasn't working, we had a high deductible plan. I was buying, and we didn't really have great prescription coverage. I was buying all my prescription medicines with prescription through a Canadian pharmacy because it was less than half the price. And you could do the same thing with through a Mexican pharmacy, but Canada, I just feel more comfortable for whatever reason. I don't think it made any sense, but you end up really becoming a consumer, which is a good thing. You're not just paying the copay and never thinking about it, but it's problematic. You guys have been, I don't know if you realize how much you have helped so many others on their journey because of how, one, awesome you are in sharing your journey, and two, the fact that you guys have been through this and thought through it in an analytical way, but also, in a human way. So I want to thank you so much.
Yeah. Well, thank you. And you do know that, and I see it at work and a lot of commentary where people sort of give up. They look at it, it becomes too intimidating, and they'll say, I'll just work another year because they just can't answer the health insurance problem, or they feel that it's too risky. And I was starting to fall into that in the year before retirement, and then I'm just like, I can't let this define the rest of my life. But I know in talking with a lot of people, they're like, they can't pull the trigger and retire because they feel compelled to hold on to their awesome health insurance plan that they get from work. And I can really understand that. There is a leap of uncertainty, especially now, because Congress is changing the rules as we are talking, and probably will change them before the next tax year. And so you really have to embrace this flexibility and be as you had said, a good consumer of healthcare so that you can make good informed decisions and trust that there will be choices that you can use.
Yeah, and very well said. You can't let this define your life. Thank you so much, guys. Hey, Nicole. What are we happy about?
Your book is out.
The book came out yesterday, officially March 20th. Now, I'm not sure if I shared this already, and my aunt was the one that pointed this out. Do you know what March 20th is?
Well, I do now, but I think you should tell everyone else because it's cool.
So, the book is dedicated to my mom. I tell her story in the book, and a lot of my experience with her has framed how I counsel clients, how I walk life with clients. And I was talking to my aunt about this, and she asked when the book is going to be released. This is my mom's sister. My mom passed away at age 48 back in 1990. And I told her the date of the book, and she said, Roger, do you know what that is? March 20th, yesterday, the day the book was released, dedicated to my mom, was her birthday. Bam! Had no connection to that at all. I didn't choose it. I had no clue when the book was going to be released and how that date was going to be selected. I don't know what that means, but it made me happy. It actually made me cry a little bit.
Yeah, it's really cool, I think.
So you can go out and go to Amazon, go to Barnes & Noble. You can get the book anywhere you want. And now I got to work on the audiobook. Exciting. So that made me happy. That made me feel, someone called that a God wink. That was God winking at you.
Yeah, I like that expression.
All right, well, let's go set a smart sprint.
On your marks, get set.
Hey, welcome to the Smart Sprint segment where we set a 7-day step to live a better life and have a better retirement. And today, this is going to be easy. If your mom is still around, because this is top of mind for me, go call her today. When's the last time you talked to your mama? Call your mama. If she's not around, call someone special to you. That's a good thing to do in the next 7 days, so go do that, all right? You'll be happy you did. Nicole, go call your mama.
I'm on it.
All right.
I'll call her after the show.
Well, I think we know the obvious call to action on the day after the book came out. And what is that, Nicole?
Go buy the book.
You could actually buy the book.
Yay.
That's amazing. So go buy the book if you haven't gotten a free copy already. By the way, if you leave a review, I still got books and I'll send you one, but it'd be awesome if you bought one too. And please leave an honest review. Lots of requests there, but we appreciate you. I'll tell you, over the last 4 years in sharing this journey from a podcast perspective with all of you, you poured into that book, just so you know that. Listening to this podcast, sending me questions, challenging me, us having the discussions that we've had, that's all in that book. All the wisdom and spirit of that 4 years is in that book. So thank you.
We appreciate you joining us today for this episode of Retirement Answer Man. Be sure to visit rogerwhitney.com/answers to access the Retirement Answer Library with over 30 checklists to help you make the most of the only life you have. Remember, you have more power than you realize to create an amazing life starting today with Retirement Answer Man. The opinions voiced in this material are for general information only and are not intended to provide specific advice or recommendations for any individual. All performance referenced is historical and no guarantee of future results. All indices are unmanaged and may not be invested into directly. Have a wonderful day.